Hello, I'm Katie. I'm a second year paramedic student. Can I just confirm your name and your date of birth?
My name is Priscilla Morlisi and date of birth 10th of October 1988.
Alright, so Priscilla, today I'm just going to perform a cardiovascular exam.
Yeah.
What that means is just I'm going to be inspecting your face, your neck, your chest, your back, your hands, your legs and your feet. Is that okay with you?
Yeah, sure.
Alright, so normally for this test we'll ask the patient to remove the clothing from the waist up so we can get a better look at their chest. But I'm just going to verbalize. So first and foremost, I'm going to go to the end of the bed. I'm going to go have a good look at my patient from the end of the bed. So what I'm looking for is there any medications near her? Is there any other equipment that she uses, such as oxygen? I'm going to look at my patient if she's comfortable. Does she seem short of breath? And looking at perfusion, so is she well coloured, or is she pale, or does she appear to be clammy or pale? And if that all seems normal to me, then I'm going to proceed with the examination. Okay, so the first and foremost, I'm just going to have a look at your eyes.
Yeah.
So I'm just going to pull down on your eyes. Just looking for anything. That's fine. Could you just open your mouth for me? Looking for any central cyanosis. Did you see that? Right, I'm just going to ask you to place your head to your left. I'm looking at her JVD. If there's any rise, and normally it should be on an angle. Sila, do you have any abdo pain?
No.
So is it okay if I press?
Yeah.
Right, I'm going to apply some pressure to the liver and just see if I can see a rise in your JVD, which I can. Thank you. So I'm going to move down to her chest. I'm going to look for any scars, any chest deformities, and that would be better if the patient was undressed from the waist up. Second, I'm going to look at your hands. Can you just hold out your hands to me like that, please? Thank you. I'm going to look at her nails for any signs of smoking, and then I'm going to do a cap refill. Yep, and that was less than 2 seconds, so that's normal. I'm going to also have a feel of both hands. They're warm and they're a good colour, so I'm just going to go over. They're also warm, just look at the lesions, and then also going to take a radial pulse, and that's regular. I'm also going to just time it and count her pulse as well. Alright, so Sila has 68 beats per minute, which is normal. And I'm just going to take both radial pulses and just check if they're equal. So equal and regular. Thank you, Sila. I would also do a blood pressure on her. And then I will proceed to looking at the skin and also the back for any other, just to check for perfusion as well. And then I'm going to move to palpation. So on palpation, I'm going to look at her chest and see if there's any scars, deformities. And then I'm going to place my hands on either side of her chest. And what I'm trying to feel for is any throws or heaves, or any palpable murmurs. And then I'm going to do a cardiac pulse. So Sila, could you just face me? Turn to your left, sorry. Yeah. So I'm just going to take a cardiac pulse. And also turn to your right. I can also assess for any lumps, check for any lumps and crepitus. So one way you can check crepitus is just by placing your hand on her knee, and also at the bottom, and then just asking you to just flex your leg back and forth for me, please. Feeling for any grinding of the bones. Any pain at all when I'm doing that? Okay, thank you, and that's fine. I'm going to move to auscultation. So I'm going to auscultate certain areas of the chest as well as feel for the cardiac pulse at the same time. So first one I'll locate is the aortic valve. which is found on the second intercostal space on the right sternal edge. So, yeah. So 1, 2, so right here. Then I would auscultate that and feel for a carotid pulse at the same time. Then I'll move to locate the pulmonary valve, which is on the second intercostal space on the left sternal edge. So from this side, just going down to the second intercostal space. I will auscultate that and listen to the carotid pulse at the same time. And then I will move to the tricuspid valve, which is located on the fifth intercostal space on the left sternal edge. Like auscultate and feel for the carotid pulse again. Then locate the mitral valve, which is best located at the apex of the heart, really, so fifth intercostal space, mid-clavicular line. I will also palpate that as well, just the apex beat by itself, and then I would proceed to just having a listen to her lungs. So Sheila, are you able to sit up for me? So had the patient had no clothes on, then that'll be better for us as well. So just going to auscultate the 4 areas. And that can give us a sign of any pulmonary edema. I'll also press for any sacral edema, which may indicate right side heart failure. Also better indicated if the patient was had no clothes on. Thank you so much. And I'm just going to proceed to the pedal pulse. First, sorry, like I said, no shoes on. Feel for a pedal pulse, and then assess for any pedal edema, which may indicate right side heart failure as well. So that concludes my cardiovascular exam. Thank you, Scylla. You can tell the patient to get dressed if they were undressed from the waist up. Wash my hands again. And then other tests that you could do for a better look at the heart is a 12-lead ECG. Thank you.